Good afternoon and welcome to our weekly Independent Sage briefing. We're going to be joined soon by Andy Burnham, the Mayor of Greater Manchester, but to start, Professor Pargle is going to take us through her presentation.
Okay, let me share my screen. Right, so welcome to today's briefing for numbers up to today. So again, we've just used numbers from the government's daily figures, the government's report on test and trace, ONS infection survey, and each nation's official death registries. And so today, I'm going to go through a number of new deaths, the number and location of new cases, and then something on test and trace, and then a summary of where we are. So this is the number of new UK deaths from COVID, and it's weekly, and it uses the Office of National Statistics and other nations' registries to do this, which is considered the gold standard. So it's people who have COVID-19 on their death certificate. It does have a lag, so data only goes up to the 24th of July, but deaths are coming down, and that is a good thing. But just to note that people who would have died at the end of July would have been infected somewhere in the second half of June. And we know that cases were still going down then. So in that sense, it's not surprising that deaths are coming down, but nonetheless, it is good news. This is now the number of new UK confirmed cases. So people who've had a positive test for COVID. And you can see that really since the beginning of July, there has been a steady increase. Basically, the 7-day average has increased pretty much every day for a month. We had 950 cases recorded yesterday compared to 846 the week before. It's not a massive increase, but it is quite steady and consistent. But can it be explained by increased testing? So we are testing more people, which is a good thing. And one way you check to see whether testing can explain it is you look at what's called the positivity rate. And this is, you look at everyone who was tested and see how many of them, what proportion of them tested positive. And there are two ways really to get tested in the UK. One is called like Pillar 1, that's test done in hospitals, so that's patients, but it's also kind of routine testing of healthcare staff. And over the last month, you can see here that numbers of people getting tested has actually gone up, not by much, but it has gone up, but the number of people testing positive has gone down. And so your positivity rate is going down, and that's a good thing. That's showing that it's becoming less prevalent in hospital settings. But now if we look at cases that are done in the community, so people like you and me, if we get tested, what's called Pillar 2, what you can see is that actually the number of people tested over the last month has gone up quite a lot, but the number of people testing positive has also gone up, but not as much. So first of all, over the first 2 weeks of July, the positivity rate went down. So we found more cases, but really much only because we tested more people. But since the middle of July, so this goes up to the end of July, this data, we are testing more people, but more and more people are testing positive. So since the 15th of July, we've increased the number of people we're testing by 12%, but the number of people who are testing positive has increased by almost 40%. And what that means is that increased testing cannot explain all of the increase that we've seen in cases over the last 2 weeks. So that kind of implies that there is some increased transmission in the community. The Office of National Statistics infection survey that was released today also said that there has been an increase over the last month, but they said there may be signs now that it's starting to level off. So we're kind of having to wait and see until next week because we're always kind of a week behind. But certainly the number of confirmed cases are going up, and at the end of July, the positivity rate also went up. So where are the cases? This is a map for the whole of the UK. So it's pretty much everywhere. Northern Ireland is the least. And here is a more detailed map for England where you can see kind of these hotspots in the northwest and some here in the Midlands and then some in the southeast. So if we're thinking about trying to drive cases down towards zero COVID, and we kind of suggested a control threshold of 1 confirmed case per million per day, we are moving away from it. Apart from like Wales has come down, but all the other nations have gone up, particularly Scotland and Northern Ireland, and the Republic of Ireland as well has gone up quite significantly. In Scotland, there's been an outbreak in Aberdeen, which has been apparently linked to pubs and restaurants, and is mostly in younger people. And the Republic of Ireland too, I think 80% of their new cases are in people under 45. And when we first started looking at zero COVID, so this red line shows where we were on the 10th of July, you can see that pretty much everyone has moved away from it over the last month, that we are seeing more cases. And how do you try and control that? How do you keep this virus under control? Well, test and trace, a really good contact tracing system is key. We've now got metrics for NHS test and trace in England over the last 9 weeks. And you can see that pretty much all of these lines are flat. I'm not going to go into exactly what they are, but there's been no significant improvement. And if it was the case that it was working really well, that wouldn't be so much of an issue, but that's not the case. So since the beginning, we've had almost 50,000 people refer to NHS test and trace as new cases. About a quarter of them are never reached. And then we're only getting at least one contact for about 60% of the cases. And we know that we're not finding all the people who have COVID either. And then out of the people that we do find and do reach, who do provide contact, for the non-complex contacts, which is people in the community and the kind of where we're now seeing most of the cases, we're only reaching just over half of them. And that basically just isn't good enough.
You've seen Pretty Potato's tweet.
There was various stories this week,
some sort of
where there was a paper coming out in the Lancet showing that testing and tracing had to be much, much better if we want to open schools safely this autumn. And we can also see that some local authorities are taking matters into their own hands and launching their own local tracing services. And part of that is just because there are things that you can do locally that you just cannot do centrally. So for instance, you can't contact people centrally if you don't have a number for them or they choose not to answer their phone. But you can go around to people's houses. If you know local communities, you're in a much better position to understand, how do you approach people? What are the appropriate languages, for instance? Where are people living? How can you get the message across? So that's the kind of reason why local authorities are starting their own local contact tracing systems. And contact tracing is also becoming increasingly important because, for instance, there was a paper out today in the Journal of the American Medical Association saying that asymptomatic people, so people with no symptoms, are just as likely to be infectious as people with symptoms. And those are the people that you find with contact tracing. You can't really find them any other way. And so it's really important that we do have this working so that we can help contain the virus. So just to summarize, deaths are declining, but the latest data is only to the 24th of July. And so we wouldn't really expect to see anything happening in deaths until the end of August at the earliest. And even then, we probably wouldn't, because we know that people infected now are younger and much less likely to end up in hospital. There does appear to be a small increase in transmission since mid-July. So over the last 3 weeks, ONS suggested it was leveling off. I guess we'll see next week. This is concerning because August should be the easiest month, and July this is when we should be able to keep infections low. People are outside, people aren't really at work as much, there's no school, there's no university, and we're seeing the cases going up. So although they're small, they can quickly escalate, and we're seeing that now around the world. So really, you do have to act now. The countries that acted when numbers are small are by far the ones that have done best in tackling COVID. And I feel like we should learn from that. If we wait until everybody is absolutely sure there's a problem, we've waited too long. So we believe that the government priority should be driving down infections now to enable schools to fully open in September. Children will have been without education for 6 months. We absolutely have to make that the priority. And this does require a much, much better contact tracing system. And again, we believe it's time to rethink the whole test and trace system. So we've had this central system now for 9 weeks. We've been following it. It hasn't got any better. It's time to just rethink it and learn from the countries that have got a really good test and trace system, which is almost always local. So we think it's time to invest those resources instead in local structures, which is already being developed in some areas in England and the other nations. And we've actually got a short report coming out this afternoon talking about how we can redesign the test and trace service in the UK. And finally, I think the good news is it's not too late. As I said, the increase is small. We still have a relatively low number of infections. We can still get infections down in time for September, but you can't do it by taking August off. You just have to do something now. And adopting a zero COVID strategy now is really how we can move into autumn safely. Thank you.
Thank you, Professor Pargle. That was very informative. We're going to go straight to questions now from, we're going to start with some public ones. So is Chris there?
Hi there, yes.
Hi, Chris.
I'm here. Hi there. Yeah, my question's related to exactly what Christina was just saying, actually. She's shown that the test and trace metrics aren't showing any significant improvement. And she summarised by saying that the resources should instead be invested into local structures. I don't know whether Andy Burnham's about, it might be something relevant to him, but I understand that some councils like Blackburn, which Christina mentioned, are taking over contact tracing once Serco stopped following up on a contact, and that this leads to increased tracing rates. Do you see an option for councils throughout the country to manage their own contact tracing at an equivalent or better level within the budget constraints of the Serco contract? So in other words, if the funds were to be reallocated.
Thanks very much for that, Chris. Who would like to take that? Professor Costello.
Thank you. Yeah, you're absolutely right. I mean, look, it isn't a question of, well, shall we go central or local? China, South Korea, Germany, they all had very strong local components because that's the way you do it. You cannot do this centrally. And if you look, look, we're aiming to open our schools and protect our economy. That's why we've been banging on for the past 6 months about strengthening find, test, trace, isolate, and support. We have a find problem, which means only between, I think Christine estimates, between 40 and 70% of those who are cases actually get a test. We know very clearly that local testing is going to get more rapid results, and it's going to be linked in to the primary care system much more efficiently so that they can advise, monitor, and treat people. And the local tracing figures are absolutely clear. We saw the complex cases that she calls, which is basically locally chased by public health, helped by Public Health England's health protection teams. They get 99%. The central call centres get 53%. I mean, it's a huge difference. And therefore, if we were to divert, I mean, actually, this is topical. At the moment, Serco and CITL have had $108 million, and that runs out towards the end of this month, and they're applying to have it topped up to $410 million. I think that should now end, and that should be moved to local authorities. There are 300 of them. We can do the sums about how many contact tracers that would get, how they could help mobilize their primary care and public health teams to do it. But then we need to focus on isolation as well, because we don't have any data about how many people isolate, how many contacts develop disease, which is a good indicator of success. And we don't know how many people in the poorest sections of society in the gig economy or the self-employed actually comply with isolation. So I think all of those, I think if we move that to local, then central government should focus on, firstly, strategic guidance based on evidence. Secondly, on financial support, as you've said, to local authorities, and financial support that we guarantee to all the cases and controls, not just those employed under PAYE as at present. And remember that statutory sick pay is only 1/3 of the minimum wage. I don't think that's the right way. And it's cutting off your nose to spite your face, because if you give people a decent pay, then they're much more likely to be to isolate at home, and then you get your economy and your schools open again.
Thank you very much, Professor Costello. Would anyone like to add anything to that before we move on? Okay, I'm now going to go to, is Wayne Monto here? Wayne?
Yes, I'm here, yeah.
Hi.
Hi there, you're okay. So my question is kind of following on from the discussion about track and trace. I suppose my question is, all the evidence seems to suggest that the local services are doing a much better job. A lot of other countries are doing a much better job at finding people than we are. Yet for some reason, obviously, our government seems to have taken a strategy of centralising and privatising how we're looking to produce results. So my question is, what benefits can anyone on the team understand from having a centralised system? And also the fact that the Guardian's just published a piece this morning saying that it seems that the local authorities are putting pressure onto the government. Are the government moving away from a system that's not working, or alternatively, are they being dragged away from a system from pressure from the local authorities, like we're seeing in Leicester at the moment, where I'm from?
Thanks, Wayne. Who would like to take that one? So, David, do you have any thoughts on this?
I think I'd rather pass this back to Anthony.
Well, I mean, in a sense, you're asking us to read the minds of the government. I don't think, well, there are certain exceptions where you might want to use centralized testing for certain smaller groups, but I've given my arguments for localizing this. Why the government, what they're thinking at the moment is almost impossible to fathom, because they don't seem to be listening to SAGE. And as Sir Paul Nurse has said repeatedly on BBC, who's in charge? We don't actually really seem to know who's in charge. And I'm sure Andy Burnham will have something to say about this, because he's under pressure to lock down the whole of Manchester. And indeed, it's the Tory MPs who are shouting at their own governments saying, well, shouldn't we be much more specific and lock down by district and the like? So there is this clash between the centre government and local government. And it's difficult to read what it's all about. Is it ideological, or is it part of the British disease, in my view, that we don't devolve power to localities, unlike many parts of Europe? Maybe Andy would like to say something about that.
Okay, thank you, Professor Costello. Yes, so Andy has actually just arrived, so welcome to our session. Andy, before you tell us about the sort of general situation in Greater Manchester, do you have anything to add to this question?
Well, thank you, and so much I could say, and Anthony absolutely teased me up there. I mean, the whole approach to this has been highly centralised, and the local input has been minimal, really. Certainly in the early days, is getting better, but it's almost the local input now is, how can I put it, kind of retrofitting a system as opposed to having designed a system that would have worked properly in the first place. So it is improving, to be fair, but I absolutely agree with Anthony that it is a reflection of a kind of centralised political and government culture in our country, where local government isn't trusted, when actually, in my experience, having left national politics and working at a local level, actually, it's the local level. It's much more pragmatic, much more can-do, and it's frustrating actually to been shouting into the system. We are now getting movement on things like data and other things I'll come on to talk about. But yeah, we're a long way in here, and a lot of these things should have been corrected a lot sooner.
Okay, well, Professor Haque, would you like to come in now as well?
I'm not a professor, I'm a doctor. I just want to add, let's step back a bit. It was baffling that this government set up a centralised system, given that from the outset we had an excellent local public health team system that was not only integrated, but was also involving GPs. And in having a centralised system, we've taken GPs out of that role, we've taken the local public health teams out of that role. And the critical thing about local public health teams and GPs is that they know local population. They know where the hard to reach groups are. They know how to knock on doors. They know where translation is required. And that was fundamental. So I think we need to ask the question, why did the government in the first place set up a centralized system when we had such a good local system set up in the first place?
Okay. Oh, thank you, Dr. Haque. Professor Pillay, would you also like to contribute?
Thanks. Well, first of all, I'd like to thank Andy Burnham for joining us. It's we're honoured to have you, and it does reflect the importance of local. I think just 2 points to make before carrying on and getting Andy's further contribution. First of all, it's self-evident that with localities having to take control, that tells you about the functioning or poor functioning of the national program. But I'm also very concerned that there's discussion of the app coming back, and we all witnessed the initial hype about that and hope, the trial on the Isle of Wight, then silence. And now I see that it's bubbling. It's been put out there. The kite is flying again. And my concern is that in the midst of all this, an app will then become developed, which of course has the danger of confusing issues and providing yet another source of data where already we're lacking integration. So I would also just hope that any discussion of an app is placed in the context of both coming to the end of the Serco contract, thinking about what's next in the test and trace, and ensuring that locality and local practitioners can get access to those data. Thanks.
Great, thank you, Professor Pillay. Okay, so now, yes, if we could go to Andy Burnham. Thank you very much for joining us today. You're the Mayor of Greater Manchester. Can you tell us how things are on the ground in the area there?
Well, thank you very much, Kitty. I will. I'll give a situation update, then perhaps a couple of observations on test and trace, and we'll throw a question to you all. But to be honest, it's an honour to join all of you, and the work you've been doing throughout this crisis has been utterly invaluable, and we all owe you a debt of thanks. So, firstly, thank you to you all. In terms of the situation update in Greater Manchester, the very latest figure I have today is that we have 28.5 positive cases per 100,000 population. That's a 7-day rolling average. And if I just describe, that's quite high. And if I just describe where we were a couple of weeks ago, it was 12.8. That was 2 weeks ago. Then it grew last week to 23.4, so almost doubled. And today we're at 28.5. The borough with the highest number of cases is Oldham. I have to say, though, they are also the top of our testing table. So they're doing almost 2,000. They did 2,000 pillar 2 tests per 100,000 population last week, which is really high. So they are testing. Which is good, but it's a challenging situation. So you can see the big change that came not this week but the week before, and we saw the government intervention at that point. What we've seen this week is growth, but at a slower level, but nevertheless still a concern. So just to maybe pick up on Anthony's point of earlier, it is difficult. It's political stroke ideological at times. I'm trying not to let that cloud things. It's got to be evidence driven, hasn't it, our response to this? And so when the government came to me a week yesterday, I'd seen the evidence, I'd seen the figures, I'd seen the sort of the takeoff in cases in many of our boroughs. So 9 out of 10 were recording an increase. And the only one that wasn't, Rochdale, had a high number of cases. I believed intervention was justified. We have a low number of cases in one of our boroughs, Wigan, but they are by far the lowest tester actually in Greater Manchester, 845 pillar 2 tests per 100,000 people last week. So, you know, less than half of what Oldham is doing. And so my guess is their cases are possibly higher. And the thing about Greater Manchester is this, and this is, you know, there is maybe a philosophical or ideological point here. You know, an every man or woman for him or herself approach is not going to defeat this. You have to work collectively. And in Wigan's case, though their case numbers are lower, they were at the top of our infection table, if you go back a few weeks. And Greater Manchester is a place where people don't live within one borough. You know, they cross the borough boundaries routinely, many times in any given day, for work, for shopping, for all kinds of reasons. So it is important, I think, to take that bigger picture approach. And of course, this is a preventative measure that's being introduced here to prevent a spike in Wigan, but also to bring cases down everywhere. So I think the government was justified, but it was extremely disappointing, to pick up what Anthony said, that already there was an attempt to sort of say, oh no, this borough is different and let's break off this borough. And, you know, some of this is divisive, I'm afraid, in terms of the politics. I'm kind of taking a stand against it. Let's be driven by the evidence. Let's do this on a collective basis, and I'll be sticking with that approach. If I can, just to turn into test and trace, I think I have some relevant observations, Kitty, that might be of interest to the Commission. So headlines, in Greater Manchester, 52% of the contacts of people testing positive are being successfully traced. And that's far too low in my view. A second figure I've been given is that the average number of contacts given by people contacted successfully is 2.5. But what that says to me is there's a lot of people giving not many contacts, if any at all. And that worries me greatly. And hot off the press, actually, something that I was given just a moment ago. We have a statistic that 60% of the national cases positive are providing contacts. So 40% are not providing their contacts. And that's possibly because they haven't been in touch with anybody, but more likely because they don't want to give the names of their contacts. And that's something I'm going to come back to, if I may, later in what I've got to say. But can I just give you a very real-time case study? Last weekend, in the Manchester area, we had a case identified at a large employer that employs 900 people, mainly from Manchester, but actually who come from all of our boroughs, emphasising the point I was making before. The outbreak control team, it got straight into gear, and the plan was implemented, which is mass testing of a workplace, and more cases began to be identified. In accordance with the plan, then the mobile testing unit support was requested, but that didn't arrive until yesterday. And there's a lot of concern then about what happened. On site, the mobile testing unit from an outside contractor on site said they wouldn't test the night shift because their contract didn't allow them to test a night shift. It was only a specified working day that they could work within. And I believe there were sort of very serious conversations with the Director of Public Health and others. Eventually, this was escalated to the Department of Health and Social Care. The contractor said they were willing to test the night shift if they were given approval to do it. To cut a long story short, it didn't happen last night, but that night shift will be tested tonight. But you're almost a week well, not quite 5 days from when this was first identified. And that mobile testing capacity to support the contact tracing system, I think, needs to be considered. Let me just give you another point that's been put to me. At the moment, we're very concerned about the delays taken by the national system to successfully contact people. And there's a protocol that says if they can't contact people within 48 hours, the names of those people should be given to the Greater Manchester hub. Now, that's not yet fully operational, but that's the proposal. We think that needs to be within 24 hours, and we're making a case for that, because 48 hours is too long. And I'm told there is no contractual reason why that can't happen. It's more a technical fix. However, this is the current national model. If we then go and knock on doors and kind of contact that person, the procedure is then to hand that name and that person back to the national system, who will then identify the contacts of that system. And we believe a much better system would be to then keep the whole management of that case within the local system, rather than handing it back to the national system. And those are just a couple of observations of real frustrations, I guess, from people on the ground in Greater Manchester. Kitty, I'll move to my calls in terms of where we go from all of this, and then I'll go into a question. I mean, the first one is data, but I think there's been movement there. As I said, we're hopeful we can get a 24-hour agreement with the national test and trace system. There was an order passed by the Secretary of State yesterday, which I think marks the culmination of a long battle by Greater Manchester to get real-time data to local authorities. And finally, an order was made yesterday that will allow this, and long overdue, we would say. So that's positive, but we want that 24-hour data, and that's a key ask. The second one, I would say, is this issue of mobile testing unit capacity. It needs to be under local control. It needs to be deployed at an instant. It should have been on site last weekend in that employer that I mentioned, not wait till Thursday, and then there's a reason why they won't test the night shift. That needs to be under local control. There must be much more flexibility in that contract. The third thing I would say, and I know the committee are today considering the break in the contract for the NHS test and trace system that's coming up. Is it the week after next? We would say absolutely the contract needs to be amended or cancelled or whatever to free up resource to local areas now, to put the teams on the ground to do what the national system can't do. So the national system, if it's to be fair, can do the more predictable, straightforward contacting of cases, perhaps people working at home, easier to get hold of people. What it is struggling to do is contact people whose perhaps lives are not as straightforward as that. And we think that should be, when it's passed to the local area, it should stay with the local area, not pass back up once they've been identified. And that will need greater capacity on the ground. So either funding released from the cancellation of the national contract to go to local authorities to build those teams and to have a central Greater Manchester team, or if that's difficult for one reason or another, staff redeployed from those call centres to a community level to do contact tracing at the request of directors of public health and health protection teams in localities. So it's either a money resource or a people resource, either one, but it has to happen, and it has to happen now, because we have to get this thing right in August. Because, if you look at our case numbers, which I gave at the beginning, if we look at the prospect of the schools reopening, we are not in a position at the moment to say we can be entirely confident about the arrangements for schools reopening. This system, the holes in the kind of the net have to be fixed. I'm going to make one last point before I go to my question. I can see I'm being prompted to do that, and I will go quickly. There's a big question for you all to think about. Why are so few people engaging with that national system? Why don't they return the calls? Why won't they give their contacts? And I would put it to everybody that it is very much to do in our poorest communities with the inability of people to follow a request from test and trace to self-isolate, because if they are self-employed on a 0 hours contract with no access to statutory sick pay, they know they can't, because they've no way of financing themselves, paying the bills, feeding the kids while they do that. And they don't want to have to tell somebody that that's what they've decided to do. And I think it's also the reason why, in local vernacular, they won't dob in their mates, because many of their mates work in the same kind of way. Who's going to give the names of all of their mates to put the pressure on them so they don't work? And I think this explains partly why the national system isn't working. And I'm proposing, this is my final call, a message from Test and Trace is a message from the government akin to serving on a jury. It's about doing your public duty. And I believe we need a situation where everybody can act on that message immediately in the knowledge that they will receive full pay and their job will be protected for the 14 days that they're being asked to self-isolate. And I think without that, this system will never work properly, particularly in our poorest areas. And if that change isn't made by the government, they are sending our poorest communities into a winter without a vaccine, without that protection, that basic protection in place. So I'll finish on my question, Kitty, to say, what do the panel think about this? And do they believe can they point me to any evidence that says financial considerations are preventing people from properly engaging with NHS Test and Trace?
Okay, thank you very much, Andy. There's a lot to think about there. Can I ask Professor Scally to comment first, please?
Hi, Andy. Nice to see you.
And you, Gabriel. Looking well.
Thanks very much for taking part. It's great. And I think you're quite right about emphasizing these local difficulties that communities have. Communities have to be at the center of this response. And at the moment they've been peripheralized and they do need to be engaged. That's not possible from Whitehall. We know that much. It's only possible at a local level. So we need to empower local authorities. The government hasn't really worried about doling out very large amounts of money at the moment. So my advice to the local authorities would be to ask for what you need to do the job properly. That's how it should start. Not operating within the same sums that are being used at the moment, but starting from scratch and putting together really, really competent teams and making use of resources like health visitors who know their communities and the environmental health officers as well. So I'd be very encouraging to local authorities. If I could ask you a question back, Andy, and that's, as you know, Andy, only too well, there's been a hollowing out of the state and there's very little between Whitehall now and the local area. We're lucky enough to have some elected mayors like yourself with a role, but for a lot of the country, there's nothing between the two. Do you think there's a need to put in some structures? You'll remember we would have had Government Office of the Regions, we would have had regional development agencies, we would have had assemblies, we would have had strategic health authorities, all gone. And how do you think it should be managed? Because not all local authorities are the same, and they really do need someone to help and support them at that level, do you think?
Thanks, Gabriel. Kitty, shall I come back on that question? Yeah. Gabriel, thank you so much, and it is great to see you. And this question about the hollowing out of the state, I've been asking myself, why has the UK been hardest hit, and why have our poorest communities been, hit hardest of everybody? And I think the answer to those questions was given to us in February by Professor Sir Michael Marmot in his 10-year update on his landmark health inequalities report, because he described the hollowing out of the state, but also disinvestment from early years, the way in which people's work has changed. This question about work, which I've put before the committee today, 0 hours, low paid, casual. That's how many people in Greater Manchester are working. And, they are not in a position to go and take 2 weeks off and sit on Zoom conferences for 14 days. They're just not. And so their employment does not allow them to protect their own health. And let me give you one statistic actually from Unison in the Northwest, who at the start of the lockdown carried out a survey amongst care assistants, 80% of whom said they feared they would not be able to self-isolate if they needed to do so because of their employment terms and conditions. Now, isn't that just an appalling state of affairs, that a caring profession can't protect their own health, or indeed the health of the people they care for? In terms of the capacity of the state, Gabriel, I think there is a capability in the Greater Manchester system, you know, in terms of the way we work together as one system, councils with NHS, and it can be very impressive, and it has been through this. But I think you've got to get to a core question here, which is the capability and resourcing of local government. That's the bit that's been truly hollowed out, if you really want to focus on it. Greater Manchester currently today has a shortfall in our budgets for 2020-21 of about £450 million. So that's the 10 councils combined with the central Greater Manchester organisations. How can they be managing the pressure that this crisis is putting on them when they have gaping holes of that size in their balance sheet? And local government has to be made a priority, in my view, for public investment, because they have lost, more than any public organisations, they have lost experienced, qualified staff, and they're always the last one on the front line trying to protect their communities, and their ability to do it is weakening all the time.
Thank you, Andy. Dr. Haque, would you like to comment on that?
Yes, thank you, Andy, very much. I mean, if I may, the other common factors between the lockdowns, for instance, in Greater Manchester and Leicester, are the high proportion of Black and ethnic minority groups. Now, just this week, the Runnymede Trust, and I'm the interim director of the Runnymede Trust, we published a survey, a national survey looking at the impact of COVID-19 on Black and ethnic minority communities. And what we found in our survey was exactly as Andy said, is that Black and ethnic minority group have been disproportionately likely to be carrying on working while the rest of us have been in lockdown. And when we explored why that was the case, it is the case because they're much more poorer. We know Black and ethnic minority groups are 2 times more likely to be in poverty, but they're also in insecure contracts, gig economy. They've also had to use public transport and so on. But there is another factor, Andy, which we found in our survey, which is that Black and ethnic minority groups were less likely to have heard about the public information safety campaign, the stay home message, the stay alert. Only 7 out of 10 Black and ethnic minority groups said that they'd heard of that message, and only 6 out of 10 had heard about the economic measures to prevent them from having to go out to work, the furlough scheme, the universal credit, the statutory sickness pay. So I think it's absolutely right. There are huge questions about access to the economic measures, which would keep those communities from very deprived areas safe. But there's also issues about the poor public information campaign that this government has run.
Thank you, Dr. Haque. Professor Michie, would you like to add something?
Yes, thank you. I wanted to go back to the points that Andy raised about test, trace and isolate. The first issue, 100%, we all agree about the absolute need for financial compensation and providing accommodation where people can't easily self-isolate at home. And if you look across the world, the countries that have done best are those that exactly provide that kind of support to enable people for the final step of the test, trace and isolate system. Because if the isolation doesn't happen, then, you know, what is the point of what's led up to the isolation? It's not going to break the transmission. But obviously, nobody yet has been able to make a successful persuasive argument to this government to put the investment in short term, as relatively poor countries like Vietnam have very successfully done, in order to get the longer term economic benefits. And I think what's becoming increasingly clear is that businesses are not happy with the kind of uncertainty, unpredictability of the current environment, where we don't know where things are heading nationally and locally. It's completely uncertain, you know, what things are likely to be like in a couple of weeks' time. So somehow the argument needs to break through that investment in this short term is going to pay for itself many hundreds of times in the long term. So one's got to take a 6 month or even a 6 year, not a 6 week strategy or a 6 day strategy, you know, the real short termism. So that's the first point. You also asked about the explanations for the test, trace and isolate system not working. One of the huge things, I mean, why people aren't getting tested, why they're not giving contacts, is a lack of trust, which we know is incredibly important for adherence. Yesterday in The Lancet, Daisy Fancourt and colleagues published an article which looked at trust in government to handle the pandemic and compared the situation in England with that in Scotland and Northern Ireland. And it's very, very stark, staying with the stay alert messaging and all the confusion around that, followed by the Dominic Cummings effect. Trust has absolutely plummeted. And we have to, or this government has to find ways of building up trust quickly, because if there's not trust in the population, then they're not going to do things like get tested, when it will then mean being asked to shop their mates, etc. And those people who are contacted, again, are unlikely to make sacrifices for that. How does the government do that? I mean, you know, we're really at a crossroads in many ways. The government has to begin doing something it hasn't yet tried. We've been talking about local earlier on in this conversation. The government needs to properly engage with communities, whether those local geographical communities, occupational communities, demographic communities, really understand and listen to their situations and show leadership that is taking all of that into account in a measured, considered, strategic way. Secondly, they need to use data not as a kind of PR stunt, but as a way of learning and learning from mistakes and learning how to go forward. We still have no data on isolation. You know, if we don't have the data shared in an open, honest, transparent way, we're not in a position to be able to go forward. So in addition to the really real material issues that you raised, Andy, I think this issue of trust and this issue of data are absolutely key to going forward.
Thank you, Professor Michie. I'm going to take a question now from Jessica Gravett, who's from the Greater Manchester area. Jessica, are you here?
Hi, yeah, I'm here.
Hi. Thanks.
Guys, sorry, I'm outside.
Sure.
Yeah, it's just a question with regard to shielding. Obviously, it's been paused across the country, apart from areas like Leicester and Blackburn. But with the cases rising in the area, I'm wondering why it hasn't changed for us as well.
Thank you, Jessica. Who would like to answer this?
Kitty, I've got to leave in a moment. Would you mind if I just said a couple of
course,
comments on what I've heard? Is that okay? I apologise.
Please do, yeah. Thank you, Andy.
The meeting for everybody, but I was really taken by what Dr. Haque said. I just couldn't agree more about understanding the structural reasons that are at play here. People in Black and Asian minority ethnic communities in Greater Manchester are overrepresented in the most at-risk professions: social care, taxi industry, security, and that's a big part of why they've been impacted most. But also housing, you know, the poor quality of private rented housing in large parts of our city region, but also across the country. You know, it's that combination. It's a lethal combination. And yes, people have been out of work through lockdown. You know, they didn't stop working. Imagine what that must have felt like to people to be in what felt to be an unsafe workplace, going home to an older family member who had an underlying condition. It's really, really poor. And the thing I wanted to say in response to what Dr. Haque said is, we all need to get the message out loud and clear that this must not descend into a blame game. It really must not. the idea that there's sort of, feckless sort of, people who are not doing the right thing, not listening. We're beginning to see the first signs of it possibly here, and fingers being pointed at different communities. And it must be resisted, and then we must explain clearly why some communities are hit harder than others. And actually, I think the point about languages, that's a learning from Leicester. People hadn't heard the national messaging. Of course, we didn't have a signer at the national press conference, the daily briefing, did we? And enough effort wasn't made to ensure that that message got through to everybody. But it is now, as local authorities have taken over. Just to pick up on Susan's point, if I may, I think trust will come a bit more, Susan, when local councils take control, because they are in communities. Council staff have been applauded actually in the streets, the refuse collectors, other volunteers who are working in our community hubs. They are trusted more, I would say. And I think people just don't, call centres are not the way people like to be contacted these days, are they? And if the group today could help us, it's about getting this shift of resource out of the national contract into districts, into councils, to build those teams, to, as Gabriel said, those trusted professionals that can then do the old-fashioned job of getting in touch with people. And Jess, your point, honestly, I'll just finish on this and I better leave. Things, you kind of, you roll your eyes when you hear some things through this, and then there's other things that make you just go, do you know what? That is just downright inhumane. And I would put the shielding decision of last weekend in that category. So imagine people in Greater Manchester shielding for months and all of the kind of psychological pressure that would have built. And then they hear on Thursday night in the media that, oh, there's a risk now because the virus is sort of increasing in certain boroughs, and therefore they'll be worried again. And then the very next day, the Prime Minister appears at a press conference and says shielding is coming to an end. So, on the one hand, we're getting a message the night before, stay within your own household, no visits. And then the very next day, the most vulnerable people in our community were told it's okay to go to the shops again, or you're going to have to go to the shops again because no one's going to bring you what you need. And I cannot, for the life of me, understand why the shielding policy was not extended in Greater Manchester and East Lancashire and parts of West Yorkshire for the duration of these measures that have now been introduced. And not to do it is inhumane, in my view, because it has added to people's distress at a very difficult time. And even at this point, they should reinstate that shielding policy, and they should do it now. And they should give resource to councils to continue the home deliveries to those people and all of the support that they need. The withdrawal of it and the timing of the withdrawal of it was frankly disgraceful.
Absolutely, yeah, I completely agree. Andy, thank you so much for being here. It's really excellent to have you, and thank you, and enjoy the rest of your day.
I will, and thank you for the opportunity, everybody. And again, thank you for the marvellous work that you are all doing. Thank you.
Thanks.
Andy, can I just thank you on behalf of Indie Sage? You're doing a wonderful job up there, and everything you have said to us here is what we have been pushing for a very long time. And we would like to see much more interaction between local leaders, mayors, and government on handling this enormous crisis.
Well, thank you, Sir David. If you don't mind, if I could just say, because I've made some sort of direct points, but when I left Westminster, I left the point scoring there. And where the government gets things right, I'll support them. And I did support them on the restrictions, as I said earlier. But I'll also directly tell them where I think they're getting things wrong. And actually, I want to move beyond arguments. I want to get us to a position where there's a strong national to local partnership to protect our communities in a winter without a vaccine, because that is what is coming at us very quickly now. And I think we've got August to get this test and trace system up to scratch. And if they don't do the things that I've said today, and particularly that financial support question, the so-called red wall that the government is supposed to be supporting, well, that will be going into the winter with its defences completely open, and there will be a human cost from that. And I'm just grateful for the chance to get that concern I've got over to you all today. So thank you, David, and thanks everybody.
Thank you, Andy. Okay, I would like to take a question now from, do we have Mariana Masters? Mariana?
Yes, hello.
Hi, hello.
Hi, thank you very much. It's been fascinating, and one of the benefits of, I guess, if there's any, of lockdown is that lay people like me have a window into decision making, which is absolutely fascinating. Thank you. I'm a local councillor in Lambeth, and very, very concerned that obviously it's been touched on. Michael Marmot's review has been touched on issues that are long-standing, are being exacerbated by COVID. I'm worried going forward what measures, as a local councillor who also sits on a scrutiny board, what measures I should be pushing to be prioritised from the local authority. I live in an area that is particularly diverse, where 3 out of 5 residents consider themselves non-white, so it's a particular problem for us.
Thank you, Mariana. Professor Scally, would you like to comment on this?
Yes, thank you very much. How lovely to have a councillor with us. And you have a really tough job to do at this time. I think Andy expressed his views about the huge financial burden that local authorities are dealing with, and you're now dealing with this as well. And I mean, if I was in that situation these days in a council, in these days as a council, I would want to build my public health infrastructure. I would want to bring together the resources I can bring together that could be used to develop test and trace. And I would work very hard at that. I would want to build a forum around your outbreak control team, which can reach out to communities and involve communities, which can reach out to the housing sector in particular, because this issue of isolation and finding emergency accommodation for people, I mean, I'll not tell you where it was, but I do know, for example, of a situation where a worker in a care home tested positive, and that worker was going back to their accommodation, and there were 8 other people in that accommodation, 1 bathroom, 1 kitchen, and between them they worked in 5 different care homes. So emergency accommodation for that sort of situation to save people is so good. And the functions of local authorities are absolutely crucial to this. And I think the things you can do are bringing people together and working closely with your local NHS and involving the general practitioner community very strongly in helping with this, communicating with your communities and the very diverse community you have as well. And also working with the other local authorities to make sure that everyone supports each other, because not every local authority is in the same position. And thank you very much for your question, and good luck.
Thank you, Professor Scally. Professor McKee, would you like to add anything to this?
Yes, very briefly. I will have to go now, but just to pick up more generally, one of the things that has come out very strongly is the need for local engagement. And to follow up on what Gabriel said earlier, we do need to recognise that not every local authority is equally well equipped to do all of these things, and the lack of a regional tier is a real problem. So we do need to find some way that we can support those that do or do not have the requisite strengths in all of this. I think one of the things that has surprised me is that, and I think it came through from Andy very well and from the councillor there, is that we have not been engaging anything like enough. And there's an irony here, because many people from the UK and in fact from central government were involved in the Ebola response in West Africa. And the one thing that came out very strongly from that is that the things that worked there were when people did engage with local communities, and the local communities were finding their own solutions. You know, for example, using coconut water where they couldn't get clean water, and so on and so forth. And this, listening to Andy talking about the struggle that he's been having to get things sorted out is really heartbreaking. If we had been engaging with local government people on the ground in the first place, we just wouldn't have had these problems. And as has been said, in August, we have an opportunity to reset this, and we desperately need to do it.
Thank you, Professor McKee. Dr. Haque, did you have anything to add to this?
Very quickly, I just want to say that in the absence of a clear strategy from government, and we at Independent Stage are still struggling to understand what this government strategy is towards COVID-19. I think it's very important for local authorities and local public health teams to remember what the priority here, and the priority, of course, is to minimize deaths, but also Lambeth has a high proportion of BME children. We need to remember that in September, schools need to reopen. Children, as Professor Christina Pagel has said, have been out of school for almost 6 months. So we need to focus on that. Focus on the FTTIS system, the Find, Test, Trace, Isolate support system. And as my colleagues, Gabriel Scali and others have said, which is really ensure that there is accommodation available for people to isolate and financial support. But our focus has to be on prioritizing schools and the reopening of schools.
Thank you very much, Dr. Haque. I'd like to ask, is Dimitri Corrigan here from the Education Journal?
Yes, indeed. Thank you very much. The question I'd like to start with is, what, in the view of Independent Sage, by how much will reopening schools increase the R rate? And my second question, which has partly been answered, is, can a national centralised call centre system like that which the government is using ever actually work to a sufficient degree for it to be safe to open schools?
Thank you, Dimitri.
Thank you.
Thank you. Professor Costello, would you like to answer this one?
I'll answer the second bit and I'll offer the first to Professor Friston. Just on the second bit, on the centralised testing, I've heard the words heartbreaking, inhumane, but nobody's used the word malpractice. If I saw a primary school teacher in my clinic and the diagnosis came back open tuberculosis, and I said, go home, I'll get the public health people to do it. And then I went on holiday for 5 days without notifying and came back, I'd be up before the General Medical Council and I'd probably be struck off, and rightly so, because that is malpractice. The story that I heard from Andy Burnham about a mobile team being told about a notifiable disease and doing nothing for 5 days because it wasn't in their contract is public health malpractice. And this needs to be called out. This is a health problem, and we have regulations about health. That's why we should not be giving this to centralized companies that have no ethics, no regulation, and treat it as, oh, a bit of bureaucracy. This is a scandal. That's a personal view, not Indie Sage. I'll hand over to Professor Friston for more diplomacy.
Thank you, Professor Costello.
Thank you. So diplomatically, so the question about whether going back to school is going to inflate the R value, I think can be answered at 2 levels. There's the level of the population and the level of your local area. So it is certainly the case that increasing the transmission by going back to school, in principle, could inflate the rate of community transmission and thereby the reproduction ratio. And if one looks for evidence for that in terms of the experience of other countries, it's rather limited. On the other hand, if you ask that question to a much more local level, are there anecdotal, well-documented cases where a particular return to school has produced a transmission event and a cluster, then there's clear evidence that this can be an important mechanism. So that's relevant in the present context of the inflation in new cases around the country, because that may at this time reflect a succession of local outbreaks and clusters in communities that have yet to be exposed. So going back to school from the point of view of a local community that hitherto has not experienced
a high instance of infection may be a very big thing. So put that against the context that nationally, there are many, many more local authorities and areas that have effectively driven down the instance of infection to a level where that wouldn't be an issue. So I think practically the question about will going back to school increase R is probably best answered again at a local level. I would imagine about 60% of local authorities would be in a position to say, well, look, our current levels of infection render going back to school a rather innocuous move from the point of view of the population, the spread of the virus, and therefore, you know, there can be a complete commitment with confidence to reopening schools fully in September. But there are a handful, and we've heard about the experiences from Andy in Manchester and Oldham and Tameside, of areas where that confidence may not be so great. So in those areas that are possibly reflecting the first big exposure, or they contain communities that have hitherto been sequestered from the viral transmission, and they're now experiencing local outbreaks, the issue of viral transmission and how it might be augmented by a return to school becomes much more pertinent. So the key, I think the key answer is no one knows, but it can be measured, and the key thing is to have the right data to be able to quantify the incidence and the reproduction ratio in your area, so you can contextualize your risk assessment.
Thank you.
Is there a difference between primary schools, secondary schools, and FE colleges?
Yes, there is from a whole host of factors. Certainly in terms of the transmission potential of different age groups, and the specifics of how you deliver education and support, which may be very different for universities and for schools. I'm going to hand over to I think Professor Michie here, because there's going to be a whole series of reports over the next couple of weeks going into very pragmatic and quantitative details from the perspective of whether you are in charge of a primary school versus a secondary school versus a university.
Thank you. I think opening up any situation where you have a lot of people in close proximity over a number of hours, often inside, from different households, is always going to increase risk. And that doesn't change no matter what age or where you are. And there are increased risks for opening up schools and colleges and universities. But I wanted to build on what Dr. Haque said, which was that as a group, we're very clear that given school children have been without education and everything that comes along with being with a peer group in terms of personal, social, psychological development, this must be a priority. And our chief medical officer a few weeks ago said we can't have it all. In a situation where we haven't succeeded in driving down to zero COVID, which some other countries have, we will have to make choices. And this then raises the situation, the issue of priorities and people's value systems. And what we are saying is schools should be in September or August in Scotland at the top of that priority list. And then we revisit other high-risk situations. For examples, universities are likely to bring in quite a lot of transmission because there are students coming from abroad, as well as people who live their lives in particular ways. Now, it may be that if we have a choice between schools or universities going online for the next 2 terms, we go with that. But this is the sort of discussion that the government should be having with the whole population, because it affects everybody, it affects all communities. It's not a simple, straightforward question, which goes back to my previous issue about how the government relates to its population in moving forward and solving this problem.
Thank you, Professor Michie. We're running out of time and we're going to have to wrap up quite soon. But are there any final comments from any of the panel on this? Professor Pogel.
Yeah, so just I wanted to echo what Professor Michie said, that there's this kind of thing as, is opening schools going to increase R or increase transmission? And yes, it's a risk, but so is opening everything else. And so in the context, we have to think about, where are we with number of cases? Where do we know that there's high risk? So we know that it's pubs, it's restaurants. We're seeing that. We're seeing it in Scotland, we're seeing it in Ireland, we're seeing it across Europe. And there are going to have to be difficult choices. And one of the ways that we can avoid making more difficult choices is by absolutely improving our test and trace system. And that's why we're saying we have to completely rethink it. Because the better that is, the fewer hard choices have to be made. So that's all I have to say.
Okay, thank you very much, Professor Pogel. We're going to have to end it there, I'm afraid, but thank you very much to the panel and to all the questions that we received. And sorry if we didn't get around to you today, but there will be more of these, so please submit your questions in the future, and see you all next week. Okay, thank you.
Bye.
Bye.